Hi there. Welcome to another installment of My Ultrasound Diaries. On this day, I scanned a 57-year-old female who was referred for an ocular ultrasound evaluation on account of a history of blurred vision. Upon sonographic evaluation of both globes and eyelids, the ocular contours appeared preserved and the posterior walls of the globe appeared intact. No unusual or free-floating echoes were seen within the aqueous and vitreous humor. The lenses were well positioned bilaterally with no opacification. However, within the posterior aspect of both globes, specifically at the level of the optic discs, small echogenic nodular elevations were identified. These echogenic foci were localized to the optic disc region, appearing as raised reflective nodules projecting from the optic nerve head into the vitreous cavity. The findings were bilateral, affecting both the right and the left optic discs. Each lesion had a diameter of about 0.6 millimeters. The small size of these echogenic nodules precluded the reliable demonstration of posterior acoustic shadowing. Additionally, the retinal contour appeared smooth with no evidence of retinal detachment. The optic nerve sheath diameter also appeared within normal limits. The presence of highly reflective nodular echoes at the optic nerve head in both globes was suggestive of bilateral optic disc drusen, which represents calcified hyaline deposits within the optic nerve head. Most calcified drusen demonstrate posterior acoustic shadows. However, due to the smallness of both lesions in this case, it may have been difficult to elicit shadows. Notwithstanding, the visualized echo pattern made drusen my most likely diagnosis. And here is my report. Both globes demonstrate preserved contour and intact posterior walls. However, small, highly reflective nodular elevations measuring 0.6 millimeter transversely are seen at the level of the optic disc bilaterally, projecting slightly into the vitreous cavity. These nodules demonstrate increased echogenicity. However, their small sizes precluded reliable demonstration of posterior acoustic shadowing. No evidence of retinal detachment or vitreous pathology is demonstrated. Impression: ultrasound features suggestive of bilateral optic nerve or disc drusen. Stay tuned for more ultrasound.